Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally, and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Hi, everybody. My name is Susan Spell. I'm a nurse practitioner, and I am here today interviewing Joanne Evans, and she is an amazing nurse. She is a leader in nursing and lifestyle medicine. She's been a nurse for 50 years. She is a clinical nurse specialist in adult psychiatric and mental health nursing. She is a national speaker, an author, a mentor, a leader, an advisor to the McDougall program, and is on the board of the Physicians Committee for Responsible Medicine, also called PCRM. She heads up the networking subcommittee of the RN-APRN member interest group of the American College of Lifestyle Medicine, and she is just a beacon of light for the rest of us nursing professionals really wanting to make our way through lifestyle medicine. So she was one of the early nursing leaders in lifestyle medicine. And not only is she a skilled psychiatric nurse, but she's been a leader in the world of lifestyle medicine. She is an active mentor for people like myself and many others. She goes around engaging different groups to get them interested in different aspects of lifestyle medicine, in particular, the plant-based nutrition. So I'm really excited to talk to her. Thank you, Joanne, so much for spending this time with me. I really appreciate you.
Thanks so much for that wonderful introduction. I'm very appreciative.
Yes, you're welcome. And you've always been so kind and so generous and just willing to share your knowledge with all of us and have a really collaborative spirit. And I love that. I think we really need that in nursing and across the board in healthcare. So I do have a few questions for you. We'll get started. I would love for you to tell us about or provide us with an overview of your role as a nurse in lifestyle medicine, whatever role that is now, and how it's been, maybe how you've incorporated it into your practice and what you're doing with it now, if you could tell us about that.
Sure. I essentially initially got involved in plant-based nutrition and lifestyle medicine back, probably 12 years ago when I had my own issues with mercury and toxicity. And at that time started reading about nutrition. And what I learned was very different than what I learned at school. In fact, it was so different, I realized I never learned anything in school about plant-based nutrition or how nutrition impacts health whatsoever. And so at that time, I started teaching, as I was learning, I started teaching other nurses what I knew about plant-based nutrition. And it was just amazing to me over the years how quickly nurses are becoming much more involved in plant-based nutrition and lifestyle medicine, which is absolutely wonderful. Because back then and is now, there's so much information and quote research on nutrition. And I think everyone is just overwhelmed with all the information, and half of it contradicts the other half. So it's just really pretty confusing for anybody who really wants to make an attempt at trying plant-based nutrition. Lifestyle medicine, I think, is a little easier when we're talking about sleep and exercise and networking with colleagues and with family and friends. I think those are a little easier. I think nutrition's the one that is really pretty confusing to people. And when I started, I did not teach 100% plant-based nutrition. My feeling was if people could be on the continuum, if they could be 50%, 60%, 70%, anything would really be helpful. I think when we teach 100%, it's overwhelming for people. And what I usually do is help nurses figure out why they would even want to change. Nutrition is a big part of everyone's life. And trying to make a change is really challenging unless you know why you're going to do it. Now, for people who are doing it for animal issues because they don't want to be part of factory farming, I think that's a little easier. Other people want to do it for the environment, and I think that's a little easier. But when it comes to health, I think that's the one that's more challenging. That if people are in good health, they're like, why should I change? And so it's important to have people figure out why they really want to change. Now, if they've got health problems, if they've got diabetes or heart disease or obesity or osteoarthritis or any of the major medical issues, I think then it's a little easier for them to understand because many of them just want to get off medication or,
Right.
they just want to feel better. So for them to understand how they can do it. But I do think it's really important for nurses to understand why they would want to make a change, because if you don't understand why, it's just really difficult,
Right.
especially
That's
in this day where we're just inundated with processed foods. I've always said if it's got so many ingredients, you can't identify them. It might not actually be a food. It might
right.
it might be wrapped like a food and look like a food, but it might not actually be a food.
And so could I
go ahead.
ask you a quick question? When you're talking about nurses, so in your role, as you see it either now or however it has been in the past, are you asking nurses to consider their own diets? And are you asking them to also help them help their patients with the diet?
Absolutely. Yeah, absolutely. Because I do think it's really difficult to teach something that you don't practice. So if you're practicing 60, 70%, it's easier to teach that to people. If you're not practicing at all, I think it's really hard. And it's clearly hard for the patient to be talking to you and you're not real clear on why you're doing it or why it's important or what some of the research is. So I do think it's really important that nurses be able to practice part of what they're teaching people about nutrition and also about sleep. If nurses are not getting enough sleep, that's a problem. That's definitely a problem. And we all know nurses have between the shift work and a lot of stresses, it's hard to get really good sleep. And of course,
And
exercise is another one.
Right. And that's one of the calls to action for the future of nursing is for nurses to be able to take care of themselves because it's so important. I think the pandemic really spotlighted that issue, but it was an issue even prior to that. My feeling is.
Absolutely. But I also think nurses need to ask their organizations to be more supportive. I think nurses who work in hospitals should not have to be struggling to get healthy food. They should have healthy food in the hospitals. And I think patients have a right to healthy food. They shouldn't have to be eating fast food restaurants that are in some of the hospitals or hamburgers that are just greasy and loaded with fat. I think nurses have an obligation to take a look at their organizations and see what they can do. I know I just returned from the International Council of Nurses conference in Montreal, which was 120 countries with 6,000 nurses. And the plant-based lunches were gone immediately. Those were the first ones left. And roast beef and turkey, there were tons of sandwiches left in those two categories. So it's clear that there are a lot of nurses are very concerned about getting healthier food because the plant-based option of food was excellent at the conference for all the meals. So I think nurses need to be pressuring conference organizers when they go to conferences, they want vegetarian meals, they want plant-based meals, and they need to ask them. So I
Right.
think that's important. And for the organizations they're working, I think when there's any kind of meeting, a nurse should ask for plant-based option for food rather
Yes.
than donuts at morning meetings. You can ask for fruit, you can ask for oatmeal. And I found many times administrators are just waiting to hear from what nurses want.
Yes.
And they just don't know. It's not because any fault of their own. It's really because nurses haven't been clear on what would be helpful,
Yeah.
especially when for meetings and lunches.
Yes, I absolutely agree. And I think part of that is us stepping into that leadership role and
Mhm.
feeling comfortable with what we know about the science around that, not only for ourselves as preferences, but also what we know about the science and how we can leverage that with our own lives, the institutions, the conferences. It goes across the board. And to be able to be an advocate, because we're comfortable being an advocate for our patients, I think generally as nurses, but also be
Absolutely.
an advocate for ourselves and an advocate for good nutrition.
Absolutely. Yeah, absolutely.
How do you see, you mentioned already once about you've seen this growing interest in nurses. How have you seen that? How has that been apparent to you?
I think you can go to any meeting or conference, and number one, there are many more meetings about plant-based nutrition and lifestyle medicine now than there were even 3-4 years ago. And so you get on Zoom meetings or you go to conferences, and there are many more nurses there attending them. At the Lifestyle Medicine Conference, the last two, there's been a huge number of nurses, and we've outgrown the rooms, and it's been great. I think, and we're reading more about nurses doing things. When I wrote the book, Cultivating Seeds of Health with Plant-Based Nutrition, I interviewed nurses, and this was 6 years, probably about 6 years ago, and there weren't many nurses. And now it's much easier to find nurses who are starting their own practices, they're teaching. One of the big issues, I think, in nursing schools is that we need to see it in the curriculum. That until we see it in the curriculum, I think it's hard for nurses to learn about it. I know from the nurses I talked to, most of them learned about it after they got out of nursing school. So there are some schools that are beginning to teach lifestyle medicine, which is great. But I think that's where we need to make a change, is in nursing programs.
Right. Again,
teaching-
advocating for
Advocating.
ourselves and our education.
Absolutely. Absolutely.
So what strategies do you use now? It sounds to me like you are educating nurses by way of conferences and presentations and things like that. And what other strategies are you using to connect with other nurses?
I think it's really important to listen, to really focus on listening. Like, why would someone change? What are some of the problems they're experiencing? But I think foremost, you really need to listen to what nurses are saying, or to ask people, is there anything you'd like to change about how you feel? And I think that's just really important, because unless someone identifies what they're struggling with or what they want to change, people usually don't change. I usually talk to people about the process of change and the stages of change, and be able to say, right now, you might not see a problem. Later, you might see the problem, but you're not really ready to change. And then you might be ready to change. And then you start getting a lot of information to change, and you actually might change. And then you might have some setbacks, and you just have some setbacks, and then you go back to making the change. So I think letting people know the process of change is really important, because sometimes people hear the information and they're not ready to change. And I know I've been teaching for years, and people will come back to me 2 or 3 years later and say, Joanne, I remember when you said this, and I just wasn't sure it was right. But now I know you were really right. And I'm really glad to see that I've made some changes. And that's great to hear, because for me, it really doesn't make any difference when people change, whether it's today or next year or in 3 years. As long as they're feeling good and they make the change, that's what's important.
And what you're saying there without saying it, and I just know it because I know you and I know how you operate, is that you are non-judgmental and not pushy. And people respond when they encounter a nurse like that, right? Who is compassionate, I would say.
Yeah.
and that knowing that this is what I can say to you. And if it's not your time, that's okay. And not judging them for that. That's really important, I think.
Yeah. And I think one time you don't talk about food is Thanksgiving, or when you're out with friends
Right.
for a meal. That's just, and people, because that just doesn't go over well. And you end up preachy, and it's no, you just,
Right.
Yeah. I usually just, if someone starts talking to me and say, why are you doing this? I said, that's a great question. I'll be glad to talk to you later about it. And then I switch it to something for them.
You don't want to be the food police at dinner.
No, no. And
And-
I've also been with plant-based friends who have occasionally had an egg, or they've had some cheese, and they were like, Joanne, is this okay? And I'm like, are you kidding me? I'm not the police. As long as you feel good about it, it's fine. Like, none of us are 100%, or some
That's
of us are, but most of us aren't.
I get that. What do you think, since you've discovered lifestyle medicine and plant-based nutrition, what do you think some of the biggest challenges have been with your efforts, whether that's connecting with nurses, getting nurses to understand, or even working with patients, like whatever across the board? What do you think some of the biggest challenges have been, and how have you overcome them or seen other people overcome them?
I think one of the biggest challenges, people are surrounded by food, or what looks like food, and it's 24 hours. Years ago, you used to have breakfast, lunch, and dinner. You might have an occasional snack. Now breakfast is mid-morning snack, lunch, mid-afternoon snack, dinner, snack before you go to bed. That we're just surrounded by food. And I think that's really hard for people, because you're constantly being deluged with the vision of food, reading about food. I just think that's just really hard for people.
None of us are immune to that.
Yeah,
And-
we're all human. And I think the issue of sugar is a big one for me, because I think they put sugar into just about every food that's on the market, and we get addicted to sugar. It's addictive. So it's really hard, when you're surrounded by sugar and you've got it in your system. I
Right.
think the people who are working with children, they're the ones who really deserve a lot of credit, because I think getting families to change is really challenging, especially when one person wants to change and the other person doesn't. Kids are constantly, they see tons of stuff on TV. And I think taking kids to the grocery store can be a challenge, because they want to get what they see on TV.
Right.
So it's a challenge.
And it's not a lot of broccoli that they're watching on TV.
No. The other thing is, broccoli doesn't make money. When you
No.
think of the whole marketing issue of who's doing the marketing, it's usually the high sugar companies, because
Yes.
broccoli and carrots, they don't make money.
What do you think are some strategies that you've used or nurses can use with patients and families to offset that, or be able to overcome that challenge of being constantly bombarded with?
I would ask them why they want to change, because if they don't want to change, I just put everything on hold. But I do let them know that you're on medication. If you don't like the side effects, or you want to make some changes, nutrition can have a big impact on that. So I do let them know that nutrition can definitely impact how they feel and their physical condition. I also let them know, if they're making nutritional changes, definitely check with their healthcare provider, because I've done what they call 21-day plant-based programs for national groups and community groups. And I always tell people, when you start changing nutrition patterns, you can be impacting your medications. So it's really important to talk to your healthcare provider and to be checking in. So it's not a time to stop your medicines all by yourself.
Right.
But definitely get some support from your healthcare provider, because nutrition can be very powerful and can reverse and prevent many diseases.
So what I'd like to do just for a second is I'm going to hit the pause button to do a little summary of what you just said, how I see it, is that some of the first things you do would be education, for sure, not only about the benefits of plant-based nutrition and all the other lifestyle pillars that the American College of Lifestyle Medicine puts forth, but having people connect with their why to use as their anchor when they're going about any process of change, including their diet, understanding the evolution of the change process and that setbacks are likely, also identifying obstacles and maybe creating some way to move through those and around them, and know that when you have the setback, you can just get started again. and having that collaborative, supportive relationship with your medical provider.
Yeah, I think that's great. I think the other thing I usually recommend is that people connect with other plant-based or lifestyle medicine colleagues. So either it's a meetup or you get a couple friends, but it really is helpful having some community support. And with nowadays with Zoom, it's much, much easier. But also there are lots of meetups that do, the American College of Lifestyle Medicine has presentations. PCRM, the Nurses Nutrition Network, has free presentations that I just think there's lots and lots of information out there. And if it's possible, if people can tap into something just 15 minutes a day on plant-based nutrition, it's a constant reminder, because it's really easy to go 2 or 3 days and then forget things. But if you're constantly got a reminder of why you're doing this or getting information about it, I just think information and education is so important.
Yes, it really is.
Yeah, Michael Greger has a great nutritionfacts.org, and you can look up any disease, and he does 4 and 5 minute videos. He's also done a great book, How Not to Die, How Not to Diet. And there's another one coming out on aging. And there's great videos out there. Code Blue is one I always refer people to. If people have heart disease or diabetes, I refer them to Forks Over Knives. Game Changers, if they're into athlete, physical performance and sports, Game Changers is great. I just think there's some really great resources out there. So for people continuing to read, to watch videos, is just really important. You need to have a support system.
And that was one of my questions too, was any of the resources and things that you refer people to. So you just listed off a bunch right there. So that was great. What is the most helpful tool, do you think? Could you pick one?
Helpful tool. I think hope. I think hope is just that there's always hope out there. You might not change today, you might not change tomorrow, but you can change anytime. And so sometimes people need to get into the ditch and just feel like totally overwhelmed. And that's the thing that gets them to change. Other people, they'll change for the environment. PETA, PETA has some great videos on animals, but I always tell people be really careful because they can be really triggering. They're pretty violent. And once you see them, you can't forget them on how animals are treated. And I always say, don't show them to children. Yeah, they're definitely not for children, but for adults, I think it's really helpful to see how animals are treated before you start eating them. It really makes a difference. And then, of course, the environment is another issue.
Yes, that is great. What about, and I think for me personally, just throwing in my own 2 cents, is that when I started this, I've always loved animals, but when I started my own plant-based journey, the more I learned and understood, the more that piece about the ethical treatment of animals and the people that are working with animals in that way, and the planet and the health of our planet and the climate, all of that stuff bubbled up to reinforce what I was doing. So just as my own 2 cents in there, but
I think the people who were doing it for animal reasons, they're the people who find it the easiest. For them, it's just very easy. They're just not going to eat animals. So they tend to be the ones who are closer to 100% plant-based. Yeah.
And what are some ways that you stay up to date about plant-based nutrition and the other pillars of lifestyle medicine? What are some key things that you do to keep up with the science and the trends?
I'm always reading. I read something at least once a day on plant-based nutrition or lifestyle. ACLM has great information coming out. They have great research. Physicians Committee for Responsible Medicine has great research. Dr. John McDougall has great research coming out. So I take a look at the people who are really putting out great research. I also take a look at research that is totally opposite what I'm thinking. And so I can figure out, okay, who funded this research? Was it the beef industry? Was the dairy industry? Was the cheese industry? Because usually when I can find something that, like when they say butter is good for you, I'm like, really? So I take a look at the research. And then once you start taking a look at who funded the research, it really does make a huge difference.
Yes, I found that to be very true.
Yeah,
those are some great resources. And the ACLM, American College of Lifestyle Medicine, annual conference is great. I go
Yeah.
try to attend that. What do you think is the future of lifestyle medicine within the context of nursing?
I think we have a great future. I think change is already in the air. Patients are tired of being sick. It's too expensive to be sick. And in the past, people thought plant-based food was too expensive, but when you compared it to the cost of medicine, you're finding, no, it's really pretty inexpensive. So I think once nursing schools start making the change, and they're beginning to do that, I think they'll have a whole generation of nurses that are being trained on lifestyle medicine, sleep, exercise, nutrition. I'm really hopeful. And I think it's moving pretty quickly compared to what it was 15 years ago. There's a lot going on, and there's a larger nursing group that's supportive. It's pretty easy to find nurses nowadays who are focusing more on lifestyle and nutrition. So I think there's a great opportunity, and we're definitely headed in the right direction.
Right. And actually, some of my work with Deborah Chieli, who's working on this project with me, she really loves to talk about and remember our roots when it comes to Florence Nightingale. It is helpful to remember that she talked about clean air, good nutrition, the
Absolutely.
fundamental things, and that those things are always in the clinical guidelines, sometimes skipped over, but definitely,
They're definitely there.
What kind of initiatives or projects do you have going on right now that feed into your work with lifestyle medicine?
Right now, I'm working on networking with different organizations. These are major nursing organizations to see how they can get involved in lifestyle medicine and support their members. Is also in schools of nursing, and they can develop interest groups in lifestyle nursing and how they can integrate lifestyle nursing and plant-based nutrition into their curriculum. So I think it's just a matter of time with getting more nurses, and we educate some, and then those nurses educate other nurses. It's really just working with individual organizations and schools of nursing to make the change, but it's definitely possible.
Yes. And what have you found so far? Any particular organizations or schools of nursing that kind of stand out as rising stars when it comes to lifestyle medicine?
I think Carla Rodriguez is doing a phenomenal job at NYU, and she's got a whole program there. And I know some other nurses who are beginning to integrate at least a presentation. I know I do on several nurse practitioner programs. I'll come in and do a presentation on lifestyle medicine, plant-based nutrition, and mental health, or on any kind of chronic disease. But the other thing about nursing programs is I think we need to be educating our nurses to take better care of themselves, because they start nursing school pretty healthy, and by the time they finish 4 years, they're pretty unhealthy. So I think we need to take a look at what we're doing to contribute to that and to see what we can do to support nurses and their own health in the process.
I absolutely agree with that. And will you tell me, because we didn't talk about it at the beginning, do you work with, it sounds like you work with people or try to extend your reach across the nation and maybe even the globe, right? But what area are you in? Like what area of the country?
I'm in Indianapolis, and then I still travel quite a bit. And then I'm one of those people who loves Zoom. So I love to teach on Zoom. So I think it's a great opportunity to work with schools of nursing. I'm definitely in favor of that. And it's 75, I'm trying to retire. I haven't quite figured it out yet. Clearly have not retired. But I'm working on it.
Yeah. Right, it's just part of who you are.
Yeah. I'm not so sure I'll retire, whatever that is. Yeah.
Is there anything else that we didn't touch on that you think is really important for nurses to know? If a nurse just found this video and stumbled across it and thought, what is this lifestyle medicine thing? Is there anything else that you think that they should be aware of or know?
Yeah, I think enjoy the enthusiasm, that it's a great opportunity to learn more, and there's lots and lots of information out there, and surround yourself with people who are really knowledgeable. Go to meetings, go to conferences, ask questions. It's a great opportunity to get more education. And I think it's one of the things that can be overwhelming is that when a nurse gets excited about something, they tend to I forget that word.
Yeah, Proselytize, yeah.
Yeah, that's it.
Proselytize,
Yeah, whatever that word is.
right?
And it's important to remember that not everyone's there yet. And so sometimes taking it slow, but having that enthusiasm with people who really understand why you're so excited about it is really important. That people, again, you go back to when people are ready to change and they can hear it, but when they're really ready to change, then they'll really hear it. But yeah, it's great to have nurses get on board and realize there's a whole new area of healthcare out there that can really change the healthcare system, because I do believe nurses can change your healthcare system.
And we're the largest group of health professionals.
That's right. And we're trusted.
Very trusted, yes. So why not us?
Yeah,
Help move the needle.
absolutely.
So thank you so much for your time. There's one other thing I want to read to you, and we'll see. I think you already answered it a little bit, but I'd like to just read this little phrase. It's from the National Academy of Medicine's report called The Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity. And just see what your thoughts are about how we as lifestyle medicine educated nurses can lend our insight and experience and education to move this effort forward. So here's the quote. Nurses are trusted bridge builders who champion good health for all. The Future of Nursing 2020 to 2030 report explores how we can and must unleash the power of the nurse to achieve health equity, and how the systems nurses function within must do more to educate, pay, employ, and enable nurses to support them so they can do more. I know that resonates with you probably.
Absolutely. And I do think nurses have an obligation to start documenting how we're actually saving money, because everyone sees nursing as a sort of a cost area. Where they don't see it is how nurses are actually saving organizations and communities money by promoting plant-based nutrition and lifestyle medicine. And so I think it's a responsibility of nurses to start articulating that and to publish information about that, because money, unfortunately, is the thing that gets many people to talk.
Right.
And in fact, money is one of the reasons people want to get off their medications, because they're so expensive. So that they can see that they'll spend less on food. And there's lots of research and documentation on people. I think it's they save $750 a year by transitioning to a plant-based nutrition rather than a more traditional Western diet. But it's actually less expensive. And I think the more nurses can do to help people look at the financial aspect of it, the better it would be, and the more helpful it would be for everyone.
So both sides of the financial coin, right?
Yeah,
how we
absolutely.
save money in the healthcare system and how we can help patients save money.
Yeah. And I also think that nurses need to be financially reimbursed for their expertise. And for nurses who are in private practice, I think insurance companies, when they start reimbursing, that would be extremely helpful, rather than paying for patients to keep coming back time after time. It would really be better to pay more and have patients be cured and not be coming back as often, and have a healthier lifestyle. Yeah,
absolutely. We've covered a lot.
Yeah, thank you.
Yes, thank you so much for chatting with me. This was, of course, again, phenomenal. Tons of information and wisdom. And just look forward to seeing what more you do, how you do it, and how we can look to you to see what you're doing and how we can get inspired and do similar things.
Thanks for all you're doing. I really appreciate it.
Yes, this was good. Thank you so much.